This time in Eye on Yellow Fever.
I think the EYE strategy has had great impact since its beginnings, and we're really starting to see some substantial progress in protecting the population.
In 2020, so the first year of the pandemic, we were able to protect about 48 million people, twice as much as what we did in 2019.
We all need to take each of our tools within our toolbox in order to serve those communities that are the most vulnerable. In this case, it would be those communities that have zero-dose children, those communities that are in the remote rural areas, in the poor urban areas.
For our final episode of the series, we have brought together 3 people who are all central to the work and goals of the EYE strategy.
I'm Christopher Gregory. I'm a senior advisor in the immunization unit at UNICEF headquarters in New York.
My name is Cassandra Quintanilla. I'm a senior program manager for yellow fever in the vaccine programs team at Gavi, the Vaccine Alliance. I've been the yellow fever focal point representing Gavi in the EYE strategy since 2018.
My name is Laurence Cibrelus. I'm the head of the Secretariat of the Global Partnership to Eliminate Yellow Fever Epidemics. I'm with the World Health Organization Emergency Department.
Welcome, everyone, and I look forward to our chat today. This episode is about, firstly, looking back on the key themes we've covered over the 10 episodes of Eye on Yellow Fever. Then in the second half of this podcast, we'll look at what still needs to be done to deliver the key goals and commitments of the strategy. This 10-year plan to eliminate yellow fever epidemics got underway in 2017. So we are now more than halfway along a pathway to 2026. The risk of outbreaks of the deadly disease yellow fever is both significant and growing. This is down to a cocktail of contributing factors, including climate change and increasing pressure on land, greater movement of people, particularly into cities, and a resurgence in our highly connected world of the mosquito species that carries and transmits the disease. Yellow fever may not be the most obvious global public health threat, but it's a disease with no cure and a growing risk that must be taken seriously. We are Eliminate Yellow Fever Epidemics, that's EYE for short. From the world's most senior public health experts to those on the front line of combating this deadly disease wherever it emerges, we have the inside story on yellow fever's expanding global risk. This is Eye on Yellow Fever. Thanks for being with us for one final time in this series. My name is Nika Alexander, and I'm from the World Health Organization communications team in Geneva. This episode rounds off the series in 2 important ways. Later, we'll chart the pathway to the end of the 10-year EYE strategy in 2026. But first, with our expert panel, Christopher Gregory from UNICEF, Cassandra Quintanilla from Gavi, and EYE Secretariat lead Laurence Cibrelus, we're looking back on some key themes from this Eye on Yellow Fever series with clips from previous guests. First and foremost, because it's very much present in everyone's mind, is the impact of COVID-19.
Incredible 1.5 years. I feel a little bit like you're on in a long distance race, and at some point you stop feeling the pain and you just keep running and hope that at some point you get to the finish line. But right now, you are running, but you have to keep innovating because you have to keep finding ways to stay in the race.
That was Dr. Chikwe Ihekweazu from episode 3, summing up perhaps how every health worker has felt during this fight against COVID-19. And from the smiles I see on all 3 of you, I think what he's saying is resonating as well. Specifically from the perspective of EYE's goals and plans, what impact has COVID-19 had? Maybe starting with you, Chris.
Yeah, thank you. I think it's had a tremendous effect, particularly in the African context, where I think the EYE strategy has had great impact since its beginnings. And we're really starting to see some substantial progress in protecting the population. When we look at the erosion of yellow fever coverage in the routine immunization system over the last 1 to 2 years with the COVID-19 pandemic, It's really set us back quite some distance. And with the delays in the campaigns that had been really ramping up through the EYE strategy, it's really been a tremendous blow for us. And you see folks who are working in immunization who already had one more than full-time job, really sort of, trying to do 2, 3 jobs at the same time with the COVID-19 pandemic. That's just not possible for any length of time, and particularly for how long the pandemic has gone on.
And is going on for as well. Laurence, anything to add?
Indeed, there have been the obvious challenges. The impact of COVID on our capacity to detect and confirm yellow fever outbreaks, to respond to those. We've had delays in implementing preventive campaigns that have resulted in outbreaks breaking through in areas that remained unprotected. And there was also the impact on the routine immunization that further deteriorated after decades, actually, of stagnating and if not declining coverages.
Cassandra, what have you seen as the challenges?
Well, as you very rightly said, it has been a marathon. In the beginning, when we had the lockdowns and we had social distancing, everything was a bit on hold. We didn't have any guidance on how to implement mass campaigns in this new COVID context. In order to continue with these mass preventive campaigns, we needed to have personal protective equipment, we needed to have social distancing, etc. So all these additional measures added on the already difficult circumstances of a yellow fever campaign.
But I also really want to highlight the strengths of the EYE partnership in managing the COVID impact on our work. We were hit in the face very strongly. We had to adjust, and we did so quite brilliantly, I have to say. In 2020, so the first year of the pandemic, we were able to protect about 48 million people. And that is twice as much as what we did in 2019. So I really want to emphasize what we have been able to achieve as a partnership. It's something I'm very proud of. And I think, as also was alluded to in this podcast episode that you're referring to, we've been able to learn a lot from COVID, and we will continue to do so as a partnership. There are many opportunities that we can leverage to ensure we reach our objectives by 2026.
Not exactly answering the question that you asked, Nika, but the other thing that's been sort of amazing is the progress that's happened in diagnostics and yellow fever, and the way that laboratory network since 2016 has really become much more of a strong and resilient and quality assured institution. That's, I think, to be one of the biggest successes of the EYE strategy. It's really impressive that despite COVID, that network is still performing at such a high level, considering how far it's come in a relatively short time.
It has been somewhat a virtuous cycle. When COVID came in and we had to start tackling something that it was very new, we didn't have to start from scratch because there was already a baseline of all the learning that had been done, not only from yellow fever, but from other epidemic-prone diseases. So all that capacity building could be leveraged and sort of build on top of that in order to tackle COVID response. Hopefully, it can become this virtuous cycle where we can also leverage all the learnings from the COVID response.
Laurence, did you have anything else to add on how the EYE strategy and the EYE work has helped the COVID response?
I think it's also important to highlight that the cross-fertilization happened both ways. For yellow fever work, we also benefited from all the efforts and all the improvement, all the capacity building that has originated from the COVID response. I mean, despite the world being completely shaken, there have been impressive work and capacity building. I think it also pushed us at the yellow fever program to make sure that as resources and attention were completely pivoted toward COVID, we had to make sure we were getting our yellow fever intervention through because they were critical and very important. But the only way to ensure prioritization was to integrate those with other diseases. And I think that has really pushed us toward this more systematic integration to ensure the prioritization and also an optimized use of resources.
Another big theme in this podcast series has been the efforts around the world to get people immunized against yellow fever. We say it over and over again. The yellow fever jab is a safe, effective, inexpensive single injection that protects you for life. And we know, and this statistic doesn't yet include COVID-19, we know that vaccines generally prevent around 4.5 million deaths every year. Here from episode 6 is WHO Director of Immunizations, Vaccines, and Biologicals, Dr. Kate O'Brien.
So these are, incredibly powerful public health tools that we have. What we are facing, though, is a lot of misinformation. And we have very clear examples where when people are provided with incorrect information, false information, some of it, unfortunately, is deliberately being deployed. Some of it is just misinformed people, but some of it is very deliberate misinformation whose intent is to undermine the confidence that people have in what are important public health programs. We know that when those kinds of information are disseminated and are being, circulated, especially on social media, people die as a result.
Dr. Kate O'Brien heads up Immunization Agenda 2030, another strategy to increase uptake of vaccines and to save lives. What more can be done to increase immunization uptake and to combat dangerous misinformation around vaccines? Cassandra, any thoughts on that?
I think we first would need to understand the reasons why people are missing out on vaccines, because the reality is they can be tailored and evidence-based strategies. Back to the idea of collaboration and cross-learning, this doesn't have to be done in silos. So those reasons can be shared between a yellow fever vaccine versus another vaccine. And so we need to leverage resources that are already available. And there are, partnerships as well that are looking at innovative approaches that are also scalable. So they're not, again, working on a particular country or for a particular vaccine. Not only at the global level, but also, civil society, governmental organizations, in order to come up with these very specific strategies, again, based on the evidence collected on the reasons why there's this lag in uptake of vaccines.
The last clip I want to play actually touches on two interconnected themes, because in the context of yellow fever, they have to be taken together. I'm talking about the warming climate and also the increasing risk that exists of mass yellow fever outbreaks in some of the world's biggest and fastest growing cities. From episode 5 in the series, here is Dr. Matthew Steele from the Bill and Melinda Gates Foundation.
People are moving to cities for wage labor, for opportunities to improve themselves and their families. We often have migrants moving to cities to support their families up country. Second thing is we have movements based on climate. We're seeing a lot more movement now based on the reduction in arable and productive land and people moving to cities because they're unable to generate a living in rural areas anymore. And then the third thing is conflict. We're seeing people moving to cities to escape conflict areas, especially in parts of sub-Saharan Africa. And I think that climate and conflict go hand in hand here. Populations are increasingly economically disenfranchised, in part because the arable and productive land is reducing, which lends itself to the potential for conflict between populations over land, water, grazing, habitable space.
That clip highlights how fast changing the modern world is and how many interconnected forces are at play. How can we make sure that yellow fever awareness isn't lost in all that noise and all those issues? Chris?
Yeah, so certainly these are trends that have been accelerating for some time now, and that will increase the risk of yellow fever infections and potentially yellow fever outbreaks in large urban areas. I think that good news is that yellow fever has an extremely powerful tool, which is the yellow fever vaccine. And yellow fever has played a really historic role in vaccine history. This is a vaccine that was developed initially in 1937 that Max Tyler won a Nobel Prize for in 1951. So we've had a really safe and effective way of combating yellow fever, sort of for 85 years now. And so even though we know that the risk of yellow fever is going to increase with climate change, with migration, we have and have had for some time the tool that is really needed to combat that. And getting that message out there and making sure people have the opportunity to receive the vaccine, understand the benefit of the vaccine, is really what's going to be needed moving forward, despite the increasing risk.
Cities are unlikely to stop growing. The climate is projected to continue to get hotter. There'll be greater displacement due to conflict and other causes. Is it actually becoming harder to carry out EYE's stated goal, which is to eliminate yellow fever epidemics? Laurence?
Climate change will contribute to further shift in yellow fever epidemiology with the expanding risk. And there will be, I think, a greater impact on vulnerable populations, particularly in urban settings. And I think we do need to account that in our preparedness and readiness efforts, as well as on prevention, because this has implication on the ground. In terms of the urban risk, there is risk of urban outbreaks when there is a spillover from sylvatic or forested settings, if you like. Within the EYE strategy, what we're doing is really trying to protect the population at the source to avoid this initial spillover and then the introduction into urban settings. I think it's critical that we ensure urban resilience and that cities are prepared, ready to identify and respond to yellow fever outbreaks, and that they're also ready to recover. I mean, we talked earlier about the lesson that could be learned from COVID, and I think from the pandemic, and I think this is an important one, the importance of preparedness, knowing that we may never be ready for large-scale epidemics. One point I'd like to add is we cannot underestimate yellow fever urban risks. One of the greatest tragedy, if you like, of yellow fever outbreaks and the birth of the EYE strategy is linked to the 2016 Angola and DRC outbreaks, which was featured in episode 1, where we had 2 linked urban outbreaks with exportation of cases to China. More than 30 million people had to be protected in response to these outbreaks, with a global stockpile of yellow fever vaccine that was fully exhausted to respond to these outbreaks. So they have local impacts. They also have long-lasting impacts, because with the supply exhausted, it took a while for the preventive programs to resume, the preventive activities to resume.
For now, thanks to all 3 of you. We'll be back with part 2 of this episode shortly. This EYE on Yellow Fever podcast series is brought to you by the EYE Strategy. This, sadly, is the last of the 10 episodes in our series, so there's lots to catch up on if you have just discovered us. Go all the way back to episode 1, which, as Laurence Cibrelus says, tells the dramatic story of that major outbreak in 2016 that exhausted global supplies of yellow fever vaccine.
We knew that there was insufficient amount of vaccine to run the necessary major campaigns. This brought us to the issue of considering to fractionate the dose of the vaccines that we had available.
The idea with the fractional dose then is that the science seemed to show that yes, it could give an immediate boost in immunity, but it's just a question of how long it would last. Is that right?
Yes, and how long it would last, we need to study this, but at least the science then was showing that it can control the outbreak. I think the critical piece that I want to do at that time is to control this outbreak and stop transmission, and then we can look at the duration of the immunity, and once the outbreak is controlled.
Dr. Ambrose Talisuna, and before that, Dr. Joachim Hombach from way back in episode 1 of EYE on Yellow Fever. To learn more about the EYE strategy, our work, our objectives, and the hundreds of organizations from around the world that make up the partnership, visit the link in this episode's show notes, or just search online for Eliminate Yellow Fever Epidemics. Still with us for part 2 of this final EYE on Yellow Fever podcast, we have Dr. Laurence Cibrelus, EYE Secretariat Lead, UNICEF's Head of Accelerated Immunization Initiatives, Dr. Christopher Gregory, and Cassandra Quintanilla, Senior Program Manager at Gavi, the Vaccine Alliance. Welcome back to all of you.
Thanks. Hi again.
EYE got underway in 2017 as a 10-year strategy, meaning it's due to complete in 2026. Talk us through the rationale for setting up EYE in the first place. Why was it considered necessary, and why was it set up in the way that it was? Laurence, we'll start with you.
Actually, the starting point for the creation of the EYE strategy was the wake-up call that the 2016 Angola and DRC outbreaks was. I mean, these 2 outbreaks, and we talked about earlier, were really highlighting the increased risk of yellow fever urban outbreaks with international spread. It was also highlighting the challenges with routine immunization. I mean, both Angola and DRC had introduced the yellow fever vaccines into their routine immunization program for a while, but they had insufficient coverages. They had not done large-scale preventive campaigns. We also learned from that crisis that there were the risk of international spread was linked to travelers that we knew, but what we realized is that those travelers were often high-risk workers working in the extraction industry, for instance, and be them local or international. And that was the story of the exportation to China. And at the time of these outbreaks, I mean, we also realized that what was happening in Angola and DRC could happen elsewhere. Is actually what we're seeing at the moment in West Africa and in Central Africa with multi-country outbreaks that could have been prevented.
So looking more to the positive then, Cassandra, in your view, what have been the key successes and milestones so far? Can you pinpoint what the biggest positive changes have been because we have an EYE strategy?
Sure. Well, first and foremost, I think one of the big successes is just in itself the creation of this platform that brings together different stakeholders, and it has a venue where we can have ongoing collaboration towards the same goal. That in itself, I think it's a great milestone. What we have achieved together, it's also quite good in terms of vaccination. So routine immunization for 17 countries that are at high risk. Also having a rolling emergency stockpile. So there's 6 million doses that are available and that are renewable at any point that these are used. In case, again, that there's a need greater, we saw something similar in Angola and DRC. Also, the rolling implementation of the preventive mass campaigns. So we have seen already around 187 million people vaccinated only up to 2020. And that is in itself, I think, a great milestone. Now, if we talk even beyond vaccines, there has been also achievements. We have seen not only millions allocated for diagnostics equipment, supply, trainings, lab capacity moving forward, but already 21 countries out of the 24 that are eligible have already received some reagents and consumables. A number of laboratories are now able to confirm yellow fever samples. So before it was maybe just one, now we have 4. And overall, we have reduced by 60% the amount of time that is needed to complete the testing. It went from over 3.5 months in 2017 to 39 days in 2020. So overall, I think we have a comprehensive approach that has yielded comprehensive results.
Christopher, we're recording this in December 2021, so there is really just 4 years until the strategy's endpoint. What still needs to be done?
For me, there's 2 major things that still need to be done. One is completion of the preventive campaigns that Laurence and Cassandra have really mentioned earlier. I think particularly in a couple of large countries that are at very high risk of yellow fever outbreaks. And so I'm thinking of Nigeria and DRC. And I think Nigeria is definitely a success story of the EYE strategy. But there's a lot more work to do to finish that story. It's the most populous country, sort of in the high-risk yellow fever areas of Africa. It's a place, that has a long history of yellow fever outbreaks and that has really large megacities that need to be protected to avoid, sort of the urban transmission of yellow fever. We're never going to get rid of yellow fever entirely. I mean, there's an animal reservoir, and so we're always going to have cases. But, it's very feasible to get rid of the outbreaks if we get high enough vaccine coverage. So that's the first thing. And then the second thing is to really embed yellow fever within the routine immunization system. The response to the Angola outbreak and the DRC outbreak and the really innovative use of the fractional dose of yellow fever to make that supply go far enough to protect the population that needed it was a huge achievement in public health. But it also pointed out sort of the underlying weakness, which is, if you look at Angola is still less than half the children that should get yellow fever vaccine in Angola are receiving it. So we really need to make sure that yellow fever is an integral part of the routine childhood vaccination schedule in countries where yellow fever is a risk. and that those programs are always not just including yellow fever, but really thinking about it every time a child comes to the clinic.
Are the goals of the EYE strategy still realistic, considering that we're facing all of those things? Laurence?
This is not an easy one. The goals of the EYE strategy were set based on the risks and the needs identified. It's not because we have more challenges that these risks and needs change. So I think the question is not, do we need to reset those goals, but rather, what can we implement? What can we leverage to make sure that we do reach these goals? And I think it's going back to the discussions we had earlier on Immunization Agenda 2030. It is an opportunity to achieve a greater efficiency and for the sustainability of our efforts. And also leveraging other initiatives that are emerging, such as the Global Arboviral Initiative, that can be very helpful for us in terms of efforts to address urban risk, efforts to monitor and understand diseases and risk trends, but also for efforts in diagnostics and clinical management. For me, this is really about what can we do to make sure that we achieve these goals and ensure that there's continued prioritization and efforts to deliver on the yellow fever agenda, either in itself or in integration with other diseases.
I think what I'm hearing from what you're saying there is that, in fact, the EYE strategy helps, given all of that, given climate change, given the greater risk, given the bigger cities. In fact, the EYE strategy is a way out. It's an extra support. It will help countries not have to handle yellow fever epidemics, which is helpful if they're also combating climate change, COVID, and so on. So implementing the EYE strategy actually helps you manage those other challenges more. Is that what you're saying?
It is, with thanks. But we do need to keep yellow fever high on everybody's agenda. We cannot wait. We have, again, a multi-country yellow fever outbreaks. We cannot wait. This is catching up with us.
So just to wrap up, my last question will be for each of you, and I'll start with you, Cassandra. What extra support is needed and from where to meet the requirements that EYE has given itself?
Thanks. There's a lot of stakeholders involved in fighting yellow fever. We all need to take each of our tools within our toolbox in order to serve those communities that are the most vulnerable. In this case, it would be those communities that have zero-dose children, those communities that are in the remote rural areas, the poor urban areas.
Zero dose is a shorthand term, meaning children who have received no routine vaccinations ever in their lives.
If we can all as a partnership within the EYE community really focus our efforts in maintaining and restoring routine immunization, because as we've seen so far, that would be the sustainable approach to really try to avoid more cases and large outbreaks like what we've seen in the past of yellow fever. So I would really encourage everyone to focus on dismissed communities, to further engage with partners, specifically at regional and country level, because after all, they are the ones that have the first-hand knowledge and that are directly carrying out the interventions to fight yellow fever.
I think for me, the call to action would be to immunization managers and to the decision makers at country level to take really full advantage of this EYE strategy. This is a sort of a time-limited effort, that goes through 2026 to eliminate epidemics. But, afterwards, this risk is still going to exist. To really make sure that they protect the children and their populations in the future, they need to make sure that yellow fever is always incorporated in the immunization program, that it gets the same priorities as the other vaccine preventable diseases, and that we have a safe and effective tool to prevent it.
Laurence, if you had one call to action, what would that be, and who are you asking to take that action?
My one call will be, I would say, almost to everyone and anyone. If you are in an at-risk country, if you are responsible of an immunization program, if you are an humanitarian worker working in fragile settings, if you are a decision maker, if you are running an airline or managing a seaport, take yellow fever into consideration. The risk has grown, the risk is growing. And we can only do this together. So I think looking outside of the box and engaging everyone.
So thank you to all of you for being with us today, and thank you for your work in combating yellow fever around the world.
And I also really want to acknowledge and appreciate the beauty of the partnership and our collaboration. I think it's well reflected in today's podcast and discussion, and the fact that the three agencies coming together to discuss the status of the EYE strategy, but also the way forward, is for me very meaningful.
Well, that's it. We have reached the end of this 10-part Eye on Yellow Fever podcast series. Huge thanks to my guests today, Laurence Cibrelus, Cassandra Quintanilla, and Christopher Gregory. Thanks as well to all the expert guests who've joined us from all around the world over the course of this series. And also, thanks to my co-host, Maggie Silver from the US CDC. And lastly, thanks to you for giving us your time and being with us to learn about the vital work of the EYE strategy. Now that the whole series is available to be binged in a single sitting, please share the Eye on Yellow Fever podcast with friends, colleagues, and family. Word of mouth really helps us reach new audiences with these important messages. This episode was produced by Dave Howard with research from Amelia Jansen and sound design by Adam Whaley. I'm Nika Alexander. Eye on Yellow Fever is a Bengo media production for Eliminate Yellow Fever Epidemics.